I'm Beth Friedman.
I'm Joe Foster.
And this
is Finn Voices.
Welcome to Finn Voices. This is Beth Friedman. I'm located in Atlanta, Georgia, and I'm senior partner with Finn Partners. Today, I'm joined by Dave Wiedman, Chief Commercial Officer at Vizzia Technologies. Vizzia is a real-time location services, or RTLS, company in healthcare. They've been in business for 20 years and serve some of our nation's largest healthcare systems. Particularly here in Atlanta, Vizzia is a staunch supporter of our regional health IT community, and they even helped launch Atlanta's newest, most innovative, and some might say biggest healthcare facility. We're going to talk about that later in the show. For now, Dave, welcome to Finn Voices.
Thank you, Beth. Happy to be here with you today.
Absolutely. Dave, I don't know if you know this, but I first met your company CEO at the HIMSS Global Health Conference back in March in Orlando. And then I saw you guys again at the recent Georgia HIMSS chapter. I've just been so intrigued by your technology. A lot of the hospitals here in Atlanta have deployed your solutions. I'm particularly interested as your solutions help nurses. And I'll tell you why. I was in Chicago at a media tour. Nurse satisfaction, nurse burnout was a number one topic. Even as recently as last week, I hear nurses talk about the great resignation, I guess. A lot of people retiring, fewer young people enrolling. So nurse burnout is certainly top of my mind. So let's start there. Tell us how your technology saves nursing time and helps facilities address nurse burnout.
Yeah, sure. I'd be happy to. Well, you're exactly right. Look, burnout and retention remain huge challenges in the industry right now. Some statistics for you. Roughly 30% of the nurses resigned during that great resignation you referred to, which is identified as the period between 2020 and 2022. Look, COVID exacerbated staffing challenges that many healthcare facilities have been dealing with actually for years, Beth. On top of long, stressful hours, when nurses feel like they don't have the system support to provide good patient care, it creates morale problems, and that can really eat away at the core patient care that nurses want to provide. Look, one of the biggest wasters of nursing time and causes of nursing dissatisfaction is finding equipment when they need it for patient care. This hits close to home. My daughter was an RN who, believe it or not, started as an ER nurse at a large Atlanta area hospital during the start of the pandemic. She really signed on about 2 or 3 months right before the full force of COVID took over. And her focus, as expected, was providing care for her patients. And she'll tell you that requires a skilled team, but also timely access to the required medical devices. And so what do you think happens when, devices are hard to find? It takes a long time to get them. When you do come across them, it's not uncommon for these nurses to create their own hiding place, if you will. And this was a big wake-up call to hospital leaders, by the way, that staff was wasting a lot of valuable time hunting for supplies throughout the hospital. The fact is, Beth, hoarding of equipment was a reality as nurses wanted to ensure that they could provide their patients with the necessary devices when they needed them.
Dave, it makes sense, right? Because I'm reflecting back on that time, especially, and really any times in a busy unit, say the ICU or NICU or something like that, where it's, high intensity patient care being delivered. You need those pieces of equipment, like when you need them, right? The exact moment. And I'm kind of imagining nurses having these little hiding spots that housekeeping finds when they clean things.
Right.
So your daughter's story is really interesting and relevant too. What's the financial impact of the nurses actually doing all that sort of searching, seeking, hoarding of equipment?
It's significant. It's got a big cost and it attracts a lot of attention. In fact, Georgia State University's Lewis College of Nursing, one of the leading research universities in the nation, conducted an extensive peer-reviewed research project on the application of real-time location systems to improve healthcare delivery. And their findings, by the way, were published by HIMSS. And those highlights included some staggering statistics. First of all, nurses waste up to 60 minutes per shift searching for medical equipment. So that's, depending on the shift, Beth, either 1/8 or 1/12 of their shift. That's totally unproductive. Hospitals are losing $14 billion per year in lost clinical staff productivity. And so real-time location system technology can elevate nursing efficiency and improve patient care. Why? Because it can eliminate that wasteful time looking for medical devices. And the other byproduct is that nurse safety is enhanced with an RTLS system for staff duress and hand hygiene, which, we can touch on later. Some of the specific financial metrics that health system executives should include in an ROI calculation for these location technologies. And I'm specifically talking about asset management or medical device management. It's obviously a huge reduction in search time. Instead of 60 minutes, we're talking about you use this solution and you find that asset and its location within seconds, minutes at the most. Increased utilization of the existing equipment. What happens, unfortunately, in a lot of healthcare facilities now, they've got the equipment, but because they can't find it, now another big thing kicks in. They go buy equipment they don't actually need. So the other benefit, in addition to utilizing what you've got more efficiently, you reduce CapEx spending on equipment because it's tied to that increased utilization.
Right. That makes sense. So like if they can't find what they need, then they're hoarding it or hiding it or, wherever it's missing in action, then they're going to buy more when they really don't need it. So
That is
it
correct.
kind of messes up the entire financial picture and financial planning, I assume, around these types of assets.
It does. It does. Absolutely.
And then you had mentioned something about, I also wanted to touch on the patient safety and actually those HCAP scores.
Yeah, the other byproduct, when nurses are more efficient, then they're in the patient room more and they're providing better patient care. And when you do those things, you're creating a safer, better environment for the patient. And all healthcare executives are very sensitive to these HCAP scores, which is really when you've been in a hospital and you're at home right after your admission or your visit, quite often you get surveyed. And what do patients complain about a lot? Well, I didn't get to see my nurse much. I was calling for my nurse, and it seemed like it took her too long to wait on me or to care for me. And obviously, not only does the patient say that, Beth, we've all been involved where the loved ones, the patient's family, they're even more impatient. So when they see their loved one not getting the care they think they should be getting, they take it out through a negative survey.
Yep. It's funny. I had the experience of sitting on the other side of the bed as a family member, if you will, 7-8 years ago, in the ICU for a month, and then in a step down for a month, and then in a rehab facility for a month. So it was a long process. Through that process, many times, we would be waiting for a nurse, to your point, or the nurse would say, "Hey, I need to get such and such, and I have to go look for it." So I totally get that, and I'm thinking about the impact that had on me as a family member, especially in the ICU, right? When every second is urgent, before a patient might crash or if a patient can't breathe, or, it just seems like there's always these super acute episodes going on. So, I think about that as well. And the other thing I think about is infection rates. I know that's another thing hospitals constantly trying to battle, the hospital acquired infections. And I know equipment, devices, pretty much everything in that room, can impact that. So does your technology, in addition to monitoring the asset and tracking it, how does it help with making sure machinery or devices or anything that patient needs is properly cleaned and then ready for the next patient? Tell us how that works.
Yeah, that's a great question. A lot of people associate with infection, bacteria, disease traveling on a person's hands, and that's absolutely a factor. But sometimes the general public doesn't realize that another transporter of infection and bacteria is patient equipment. And so location systems, when implemented correctly, can ensure that the hospital's got processes that are implemented that prevent equipment traveling from one patient room to another patient room without going through the proper cleaning process. And that's got potentially serious consequence. If you've got a patient that's got C. diff or MRSA, and that equipment is not adequately cleaned before it's then moved into another patient room, you put that new patient and the staff and loved ones at risk. So when you tag devices once leaving a patient's room, it can send an alert or an alarm if they breach the doorway of another patient's room before they went into the designated cleaning area. In other words, we're going to ensure that when I take soiled or dirty used equipment out of one patient's room, if it goes any place else but the proper area for it to be cleaned, then an alarm or an alert is going to be sent out. And in the industry, we call that a cross-contamination alert. So, in addition, COVID reinforced that some pieces of equipment require a different cleaning process, which can also be managed and enforced with a location system. In other words, not all equipment is cleaned the same way.
That makes so much sense. I was just thinking about that, like during COVID, especially those early days where we didn't realize it was an airborne infection. There's just the processes and the testing and the procedures everybody was going through. I can only imagine that. Hey, I have a question for you. I just because I don't know the answer. I assume these things get cleaned by what used to be called the Central Supply Department. Am I correct or am I incorrect there?
Yeah, that's true. There's normally we always laugh, the biomed team that's responsible for this, you'll find them in the basement of the hospital. It's normally not too glamorous down there, but that's exactly right. Most processes, there is a central cleaning facility. Some hospitals distribute the cleaning process, Beth, and they do it up on the floor. The challenge you get with that, and it's an excellent question, is look, can you control the quality? If you bring all the equipment through one central area, a lot of hospitals find that's a better control point. If you've got it distributed through the hospital, it can be more efficient. You've just got to make sure you're getting the same quality.
Yeah, agreed. I was just at the AHEMA conference last week, and we were talking about centralization of denial management, right? So anytime I think you can centralize and standardize, it's better if it makes sense for patient care, for the expediency that you need to meet. But it's funny. When I worked in a hospital, Dave, I don't know if I shared this with you, but I worked in medical records, and at that time, we had those huge air storage areas in the basement of paper charts. So I actually got to spend a lot of time in those glamorous basements of hospitals as well.
Nurses are a health system's most valuable asset, and Vizzia Technologies helps you keep them happy, productive, and safe. Research shows that nurses waste up to 60 minutes per shift searching for medical equipment, and hospitals lose up to $14 billion a year in lost nurse productivity. Stop wasting time and start improving nurse satisfaction with real-time location system technology from Vizzia. Our proven solutions are used by some of the nation's largest health systems and newest facilities to address nurse burnout and expedite patient care. Learn more at the company's website, VizziaTechnologies.com.
This is Beth Friedman with Finn Partners, and we are back with Dave Wiedman, Chief Commercial Officer of Vizzia Technologies, and he's sharing some of the ways location technologies solve challenges for nurses, but also patient safety. We recently just chatted about cleaning equipment and reprocessing patient equipment and the impact that might have on infection control and patient safety. Earlier in the show, I mentioned that we're both in Atlanta. So our city is a highly competitive healthcare market. Nurses can easily jump from place to place, and I assume other metro markets are the same. Dave, let's talk a little bit about what you're seeing as it relates to something we brought up early in the show, and that's nurse retention. How are health systems addressing this? What's the impact of the location technologies on improving nurse retention, like actually helping them do their jobs easier?
Yeah, it's an excellent question, and it is a big issue that I hear executives from all of the big logos here in the Atlanta market talking about. Look, nurses will go where it's easy for them to do their jobs. In fact, one of the questions nurses are now asking their potential employers would be, tell me about your processes, tell me about your systems, tell me about how you support your staff. And they want answers to those questions, and that a lot of times will drive where they really want to go work. Look, in the Atlanta market, good nurses with good experience and a good track record, Beth, they'll have another job in a day's time. With 6 or 7 major healthcare systems in the metro Atlanta area, movement between systems, as you said, it's easy. It's a phone call away. What nurses want and need is technology to work for them, not add time to their day. Nurses want to work where they can spend their time focusing on patient care. I mean, at the end of the day, that's why they're in nursing. Locating systems make locating equipment easy, efficient, and it helps improve patient care. So savvy nurses are now knowing to inquire about whether a health system's got that kind of technology. They also want to work in environments where administrative tasks are kept to a minimum. Why? It gets in the way of patient care. Obviously, they're concerned about the spread of germs, and infection isn't prevented, or where infections are prevented and accounted for. They want to feel good about their environment. And then finally, this goes without saying, but I mean, nurses want to feel safe.
Let's unpack that for a minute, Dave. The safety factor. We live in interesting times, right? So workplace violence, workplace safety, it's a real thing for healthcare workers. We see reports in the emergency department. We see even up on the units. Nurses sometimes are right at the front line of those kind of violent situations, because they're the ones that are right there with the patient and the family and exposed to the public, if you will. What kind of capabilities, I guess, do these systems have to help keep our nurses safe?
Sure. Well, the Vizzia solution is built around not only monitoring device location, but monitoring staff location. And it's got the ability to send alerts when a staff member simply presses a button on their badge. And this alert can be sent directly to the security team, the hospital management, even the hospital security system, which can trigger a system-wide page. Most hospitals, by the way, refer that as a code white. So, our solutions make it easy for the nurse to, without drawing much attention, get help. Simply, it's a badge press.
Yeah,
And, this type of protection is becoming a must-have for some of these high-incident healthcare facilities. I mean, look, nurses share stories within their ranks about their environments and what management is doing to protect them. It's a big deal.
yeah, especially like you mentioned, right? In our highly competitive metro area like ours, a couple nurse stories get out about the hospital not doing enough to protect them from a safety perspective. And that's going to be difficult for them to keep recruiting and hiring, right?
Absolutely.
Yeah, they talk to each other for sure. Let's talk a little bit about, let's wrap up with something I mentioned earlier, which is we have a new hospital here in Atlanta. It opened, I think, last month, October. It's the Children's Healthcare of Atlanta's newest tower. And you've been there. I've not yet to visit. I'm so looking forward to it. So, I know we've been talking about location technologies, but tell us about some of the other cool stuff that you saw on your tour.
Yeah, absolutely. Well, you've got to get there when you get the opportunity. It did just open. I can tell you with firsthand knowledge that the Arthur M. Blank Hospital, it's an amazing facility. I know you and I might talk on a future podcast about, what our outcomes are at the facility, but I can tell you that they've got some really cool and leading edge technologies, in addition to tracking patient-facing medical equipment. There are robots that are very visible throughout the facility. For example, they're bringing food to the kids. They're retrieving the designated meals from the food service kitchen. They travel up the elevator to the appropriate floor and then to the correct patient room. It's impressive. It's just very impressive. In addition, they've implemented these intelligent whiteboards in the patient room, and those whiteboards display the identity and the credentials of any staff entering the patient room. And think about that. I mean, that just improves trust and communication and patient satisfaction with, in this case, the parents of the children, because they now know, Beth, that, you're a nurse, where, what your credentials are. The doctors, the same thing. They can then use that whiteboard to bring up x-rays and medical records. It's just a very, very impressive way to make the patient feel like everyone's on the same page and on top of providing, great health care. And obviously, we're also protecting the staff there. So it's just a very impressive facility.
Sounds cool. I bet those kids love those robots.
They do.
I'm imagining my son, who's now 20, but I'm imagining he was 8 or 9 or 10.
Right.
He would have been really keen on that. Yeah, for sure. I can't wait to go see it. So to your point, I will try and get an invite over there to take a tour. It really does sound fascinating. And just to drive by it, right? It's just gorgeous. So
Yes.
I feel like Atlanta finally has a true hospital of the future in our metro area. So Dave, any final thoughts on where we're headed and AI's role? And no podcast, no article in healthcare technology these days can be held, conducted, or written without mention of AI. I'm just curious, as we wrap up the show today, any thoughts on AI's impact on location-based systems?
Yeah. Well, I can tell you what, our experience has been, because certainly it's having an impact. We conducted a pretty extensive machine learning pilot at a state-of-the-art, like 500-bed plus acute care hospital. It's one of the busiest trauma centers in California, and the pilot yielded substantial operational improvements across several inventory KPIs. That included 52% improvement in key out-of-stock metrics, which is huge. Reducing overstock rates by up to 20%. Clearly machine language and AI is also optimizing workflows within the hospitals, and it's freeing up valuable time for nurses to provide, once again, more and better patient care. The other frontier that I would throw in here, Beth, is the role of health informatics. Nurses are increasingly utilizing more data from electronic health records and other platforms like that. And to better understand this trend that we just continue to see growing, we've recently added 2 experts to our team. The first, Chief Nursing Informatics Officer at Grady Health System, one of the country's largest, safety net health systems, has joined the Vizzia Board of Advisors. So that's been a huge addition. And then finally, former bedside nurse who earned her master's degree in health informatics is now a Vizzia clinical support manager. And she collaborates with our acute care hospital clients, and they love her. So, Beth, we continue to invest, and we're excited about the opportunities in front of us. And I appreciate, you inviting me today.
Absolutely. And, I appreciate you kind of focusing our conversation around the nurses. I'm headed out to a conference tomorrow. I'm headed out to Chime, and it's a gathering of chief information officers, innovation officers, data officers. But the time and time again, I hear from even these healthcare informatics professionals that no health IT, no technology solution is going to work unless the nurses like it. And so the importance of kind of always going back to that, I think, is just so valuable in healthcare. And I'm really excited to hear that you just brought on 2 nurse executives to be part of your team. So I look forward to, even fine-tuning this as we go forward, and maybe talk again later in the year or next year about what Vizzia is doing. Dave, thanks for your time. You can reach Dave on LinkedIn and learn more about Vizzia at their website, VizziaTech.com.
Beth, thank you so much. Look, I enjoyed being on the show.
This has been Beth Friedman, Senior Partner at Fin Partners. I thank you for listening to Fin Voices, where we talk about health information, health innovation, and all the technology in between. Until next time, wishing you all the best in health.